Hello friends, first of all in this video we will see about the diseases due to excess production of thyroid hormones. This condition is called hyperthyroidism, the Graves' disease. This is most common form of hyperthyroidism. It is an autoimmune disease in which antibodies called thyroid-stimulating immunoglobulins are formed. These immunoglobulins are directed against the TSH receptor in the thyroid gland. These antibodies bind with the TSH receptors present on the follicular cell membrane. The TSH binding site on receptor is occupied by antibodies. Now the TSH cannot bind with the receptor. This antibody acts as TSH. As a result, there is increased activation of cyclic AMP, which increases the production of T3 and T4. This high level of T3 and T4 suppresses TRH from hypothalamus and TSH from anterior pituitary. The TSI causes the size and number of the follicular cells to increase, and follicular cells becomes columnar, which finally leads to diffuse goiter. Due to edematous swelling of retroorbital tissues and degenerative changes in the extraocular muscles, there is protrusion of eyeballs, which is called exophthalmos. The autoantibodies may attack the skin over the lateral malleolus. As a result, there is thickening of skin and collection of connective tissue over there, which is called pretibial edema. Thyroid adenoma. A localized adenoma or a tumor develops in the thyroid tissue and secretes large quantities of thyroid hormone. It is not associated with the autoimmune disease. As long as this tumor persists, the secretory function of thyroid tissue remains suppressed due to depressed production of TSH by pituitary. Multinodular goiter. This condition develops due to decreased dietary intake of iodine, but usually iodine causes hypothyroidism. Previously diagnosed hypothyroid patient, who is taking thyroxine in excess amount, may develop picture-like hyperthyroidism. TSH secreting pituitary tumor. The tumor causes the pituitary to secrete more TSH. As a result, more T3 and T4 is produced. These thyroid hormones cannot inhibit the pituitary because of tumor, but hypothalamus is inhibited. Treatment. Antithyroid drugs like propylthiouracil, methimazole and carbimazole inhibit the functions of thyroid peroxidase enzyme, which is present on the luminal surface of follicular cell. Propranolol is a beta-adrenergic receptor blocker, which is used to overcome the adrenergic symptoms like anxiety, tremors, and heart rate. Radioactive iodine therapy causes the reduced thyroid gland function by destroying its tissue. Subtotal thyroidectomy is reserved for advanced cases in which the part of thyroid gland is removed. Now we will see the diseases which are caused due to the hypofunctioning of the thyroid gland. Hashimoto disease. Hashimoto disease is an autoimmune disease in which the thyroid tissue is destroyed by the autoantibodies. As a result, there is decreased production of T3 and T4. This decreased T3 and T4 causes the pituitary stimulation to produce more TSH. Under the effect of more TSH, the size of thyroid gland is increased, called goiter. endemic colloid goiter. This condition is caused by due to dietary iodide deficiency. For normal functioning of thyroid, 50 mg per year iodide is required. The people who live near foothills may develop this type of goiter. Abnormality of the enzyme system. These are as follows: deficient iodide trapping mechanism, deficient peroxidase system, deficient coupling of iodinated tyrosine, deficiency of the deiodinase enzyme. You can see the details about these enzymes in my previous videos. Goitrogenic substances. There are so many goitrogenic substances like turnip and cabbages. These substances have the propylthiouracil type antithyroid activity. Pituitary hypothyroidism. In this case, there is destruction of the anterior pituitary cells like thyrotropes, etc. As a result, there is decreased production of the TSH, T3 and T4. The decreased thyroid hormones cannot stimulate the anterior pituitary because of its destruction, but TRH can be released by hypothalamus. This type of condition is found in Sheehan's syndrome. Hypothalamic hypothyroidism. Due to some pathology, the hypothalamus becomes hypofunctional. This leads to decreased production of TRH, TSH, and eventually decreased production of T3 and T4. Cretinism. This type of condition occurs in fetal life, infancy and childhood, in which there is body growth failure and mental retardation. Cretinism is caused by congenital lack of thyroid gland called congenital cretinism. There may be genetic defect in the thyroid gland, and lack of iodine in diet is called endemic cretinism. This is all about the diseases of thyroid gland. Thanks for watching.